Hi and welcome to Cnotes. This is John, and today I'm going to show you how to navigate the conditions buttons. Conditions can be found almost anywhere in Cnotes. So let's get into Cnotes. We're going to type in 3 pieces of information as you see and hit done, and that opens up our departments. So conditions can be found almost anywhere, as I said, but the contents will vary according to the treatment onto which it's associated. So today we're going to show you conditions in prosthodontics. So we're going to hit the crown button and we need to select a tooth. Arbitrarily I'll select tooth 13. We'll hit done and we're going to open up the crown treatment. And in pre-op, which is the first procedure, you'll see at the top of the panel are conditions. So this opens up our conditions button, and it's also very similar to operative. Prosthodontics, all the conditions are very similar. So now, a little bit about conditions. You notice this little icon here. That indicates that the note is asking you to type or press or identify a location. It could be generalized maxillary, mandibular, anterior, posterior, or a individual tooth. So today we've said we are working with tooth 13, so we're going to identify its conditions. I'm going to hit secondary decay, and we're going to identify the tooth, which will be tooth 13. Notice it says once you identify now the surfaces or cusps. So we're going to say it's mesial and distal, and also buccal is where the decay is located. And we're going to hit commit. Now, the conditions panel, we wrote this in such a way that it would be condition centric when you're thinking, but also it becomes tooth centric in the note. So for example, you saw the toast pop. Now we're going to identify that it was a failing crown also. So what I want you to do is hit conditions. You can identify the tooth again, 13, so it knows what it's talking about. And you can hit, if you want, you can say where it was failing. We can say mesial, buccal, and distal again, and hit commit. And you'll see 13, secondary decay, mesial, distal, buccal, failing crown, mesial, distal, buccal. And so other areas of conditions that are prosthodontic related, we can have tooth related conditions such as fractions, cracks, fractures, split roots. We can also have bite related conditions such as collapsed bites, crowded teeth, poor bite alignments, reduction in vertical dimension, worn dentitions. We can have defect and edentulous conditions. We can have missing teeth, pathologic bone loss, traumatic bone loss. Appearance related needs, we can have crowded teeth, poor tooth alignment, psychosocial conditions, unhappy appearances, unsightly restorative condition. And we also have a complete denture and RPD related conditions such as bony exostosis and gingival irritations, ill-fitting dentures, things like that. So these are conditions, and to get out of conditions you simply hit done, and you can close the panel and move on. This is John for Cnotes, and thank you for watching.